Good morning, everyone. This is Rachel Burgess Burnett, Deputy Commissioner here at Children's Services Division. And with me I have
Tiffany Junkins, Manager of Children's Services Division.
And
Tom Mose, I'm in the Children's Services Division helping out with the technical parts running the webinar.
And thank goodness he's here, everyone, so that I don't mess this up. So good morning, everyone, and welcome. I'm actually going to go over some slides really quickly, and some of them were slides from our previous EDPD, but I just wanted to reiterate some of the messages. But the first thing I want to do before I actually dive into it is I want to take a moment just to make sure, and I don't know if everyone has heard, but if you have not, I did want to take a moment and share some sad news, and that is Maria Whalen, who is the president of Illinois Action for Children, passed away suddenly yesterday. And so I didn't want to get into this and not take a moment out of respect for all of what she's done in this field in early learning here in the state, and with the Illinois Action for Children and its advocacy role in everything that she's done with and for children, from her work at Carol Robertson Center for Learning and then forward into a few other positions, including working at the city and then at Illinois Action for Children. So just wanted to take a moment to do that. So with that, I'm going to now go ahead and get started with our slides. So go ahead, Tom. And so if you have any questions, of course, you know that you can put your questions in the chat box, and we will take some time after we get through the slides to actually start answering questions. But the things that we're going to go over today, again, I'm going to give you the update on COVID-19 in the state. We're going to go over and remind everyone Census Month is June. Go over some slides, and I really want to do some detailed work in talking about reopening childcare, some of the things that I'm asking of you, some of the things that DCFS is asking of you, and I know some of the things that you're asking of your children, families, and staff. Reiterate staggering reopening, what we mean by that, and then talk specifically about some responsibilities. Talked about them before, but I've added a couple of others. And then just reminders for the next couple of trainings that we will have for webinar. So go ahead, next slide, Tom. So again, the stats are always staggering when you look at Illinois. 129,837 positive cases as of June 10th, so the number is beginning to decrease. We have surpassed the mark of 6,000 deaths in Illinois, and we've tested over 268,000 individuals in the state of Illinois, and there's testing centers that have reopened across the state so that individuals can go in and be tested. And so again, Census Month, June is Illinois Census Month. We want everyone to get their census done for themselves individually, but what we want you to do is make sure that your staff and that your families are getting their census data done as well. And so within the slide here is local Chicago information. 2020census.gov is there for you, and there's also social media. We all count Illinois, and Illinois Count Me In 2020. So hashtags. There's information out there. The city and the state has put out information across the state and across the city, trying to encourage everyone to get it done. As we know, the census takers aren't coming to the door of people's homes at this particular time, so we really do want people to go online and get their census applications and everything completed. So we encourage you to encourage all of the families and community residents that you come in contact with to please get them to get their census data done. And one of the things I want to remind everyone, those numbers make a difference. Makes a difference for funding, for Head Start funding across the state, and many other funds that we use throughout the city of Chicago to support children, families, seniors, homeless, for example. We count on that census data because it makes a determinant about the level of funding. So these are trying times, and we need funding at the right level. So please, please, please encourage everyone to get your census done.
And we also have a goal across the city of Chicago, right? So, Rachel?
Yes.
The mayor has set a very ambitious goal for the census for 75% response rate. And we definitely want to make sure that we're working on that. The national average is at 60% response rate. And so we want to make sure that we're reaching those hard to reach communities as well. So our immigrant families, refugee families, we want to make sure they should be counted in the census as well. And so we want to make sure that you know, so that way you can communicate with your families so that they can go ahead and make themselves counted.
Thank you, Tiffany. Next slide, please. Go ahead, go to the next one. Next one. So again, just one of the things I want to remind everyone, and I mentioned it before, want to say it again, that as far as the funded programs that we have here in the city of Chicago, we will be staggering the opening. We have had a couple that have remained open that were emergency child care centers, had a couple that actually opened on Monday, June 8th. I've gotten dates from many of you from June 15th. I've got June 22nd, June 29th, and a few of you who said July 6th. And so just know that we know that everyone is not opening the exact same date. I have consistently said that both to the mayor's office and also to our regional office again this morning and speaking with her to make sure that everyone understands what the data and information that people will be getting will show that across the city of Chicago, we will get these centers open, but we won't have it like a light switch. It won't be. It will have to be a very considered opening, meaning that we need you to do everything that you're doing and your due diligence on your end and working with your staff, working with your facilities, working with your vendors and everything that you're doing in order to make sure that your agency is prepared for a safe opening. We understand the community impact in some of our communities. What we're saying in those respects, it's let us know what your needs are. Let us know what you think works in your community as far as you're reopening your centers, and we're going to work with you to make sure that, because this is about health and safety, this is not about rushing to get this done. We want to make sure that we can open up our facilities. We want to be healthy when we do it, and we want to remain healthy throughout. And so to do that, we've got a lot to consider in a city as large as Chicago, and all of those things are on the table for us as we're going through this. We understand staff availability is a big piece of this, and you're having the ability to have your staff come back. And I know a few people have posed the question, what do we do if we've got staff that don't want to come back because they're concerned? My recommendation has been and will consistently be that we need to say to our staff and to our families everything that you're doing within your facility that is helping them understand how you plan to help them stay safe, because that's really what they're looking for, is to know that this is a well thought out plan, that you have a clean facility, that you have health and safety procedures in place, that you have policies and guidelines that you're following, and we've shared those. And if there's more information that's needed, please let us know. But following all of those will mean we're able to operate safely within our child care centers. And so again, please reiterate to your staff what your plan for reopening is and all the things that you're doing with and for your particular organization and how you're keeping yourself and others safe in your environment. And again, the other one is family response. We understand that parents are concerned as well. And so the same messaging, and I know that there's been Zoom meetings, and I've heard about all kinds of ways that you're reaching out to families, and I thank you for that, to try to make sure that they understand that, again, you're spending time thinking this through and working it through at your organizational level and at your site level to make sure that you're able to reopen your sites in such a way that, again, is healthy, yes, and that you've got safety in mind, that you have thought about how people will enter your building. You've thought about how many classrooms you're going to open, meaning the groups because of the diminished group size. All of those things have been taken into consideration, and I can see that in the plans that we've received. And I want to take a second and say thank you for those of you who sent in your plans, because I'm actually going through every one of them. And when I see that there's something that's not there, making a recommendation or asking for more information. And I know that licensing reps are doing the same thing after they receive them. If they need more information, they're sending back and asking for additional information. Because again, across the city, across the state, the goal is healthy and safe environments for our young children. That's what we're working on, and that's what we want you to work on your side as well. And so some of the things that delegates have to do, and I just mentioned one, and that's you have to do your reopening plan. you have to send that reopening plan to your licensing rep at DCFS, and we're saying that you have to send the same plan to us. I didn't want to make this cumbersome by asking you to do a secondary plan, but what I have done is included in the request that supervisors are sending out additional information that we need. What I do need to know are the number of children that you're going to serve when you reopen. I need to know the group sizes and the ages, and I need to know the number of staff that you're going to have when you reopen your facilities. I am going to have to report to HHS every 2 weeks on who's open, how many children you're serving, and all of this information. So it's imperative that we have it so that we can consistently report how many children we're serving on our funded grants across the city. And so I know it's a little bit much to be asking because some of you are still thinking about it. What I'm asking you to do as soon as you have decided exactly the number of groups and number of children, I need that information so that I can put that into the report that is required every 2 weeks. You need to determine what plan also that you're going to implement for families that you're not serving. And let me remind everyone, we all understand that we're giving you a diminished number of children that you can serve 3 to 5. When you're not able to serve all 15 or 17 of your children, our question is, you have a group size of 10. What are you doing within for the other 5 children, for example? We need to know that. We need to know how they are going to remain connected to you. Are you doing remote? You should continue to do remote learning. All of those children are still your enrolled children. And let me explain why. In March, when we closed our centers, we sent in a static report of enrollment. In other words, we captured enrollment at that time to say how many children were enrolled in each and every one of your programs and your sites. Now what we have to do is show how many children are center-based or being served center-based, and how many of those children are still going to be connected to you through remote learning, access through other ways that you're working with your families. And so I need the complement of both, and you need to be giving us that information about both the ones that are center, that's going to be in face time with teachers and classrooms, and those that are going to be at home where your staff are going to be reaching out to them and having Zoom meetings, sending them documents, activities for the children, those things that you're going to continue to do until you're able to ramp up and include additional children. Again, the reopening is a soft reopening. You're able to open if you have not operated as an emergency licensed facility. You can only do groups of 10. After 4 weeks of successful reopening, meaning that you're able to get through your disinfecting, sanitizing, all the things that you've put in place, your ability to feed children with plated meals, because we can't do family style, that you've got all of these things and everything's running like clockwork. You're able to report you've been able to do that. After those first 4 weeks, then you're able to include more families. And so those families that you've been serving remote that you're now bringing in, you will then report back to us so that we know how many of those, again, are now in center-based care. So you will maybe in your group size go from 10 maybe to 12. You may get to 15 in that group size. We will want to know exactly where you are across this process. And we'll continue to work with you as we go through this. But again, we understand that we'll be wrapping up over time, but we'll have to consistently report on our numbers to our funders.
I also wanted to take an opportunity to make sure that everybody knows that Rachel has worked really hard on our CEL free e-learning platform, and it is tremendous. If you guys have not had an opportunity to go ahead and see this website, I want to make sure that in our next CSD update that we're publishing this information and getting that out to you, because this is going to be a dynamic platform for you to be able to share with your parents so that those at-home remote learning activities can continue. That's going to be very important for you to be able to express that in your written plan, okay?
Thanks, Tiffany. And so, I did work hard on it. Thank you for acknowledging that. There's been a lot of things going on, but I wanted to make sure that we had something that we could give to parents and to use, because parents were struggling at home. And I know you were doing a good job of what you were doing every day with and for your families. But we were hearing from parents that they just needed more. And we had a Chicago Early Learning website. What we needed to do was increase on that website and the access for our parents to go in. We worked with Teaching Strategies and Ready Rosie so that we could access some of what it was that they had, so we could make sure that it was accessible. When we put it on the website, we recognized it was more than just our Chicago Early Learning enrolled families. What the point for that was, if we can get many, many more families out there that are not currently enrolled, interested in understanding the value of early learning, that many of you will find that you may have easier time trying to encourage parents to enroll in your programs. And so we're going to be using that tool and that site to continue to get information out to families about the value of early learning as we go through this. The early learning platform that Tiffany just mentioned is on the same the website where the universal application can be found at chicagoearlylearning.org. And if you click on the resource tab on that page, you will get to e-learning. There's also COVID-19 updates and other pieces of information that's there about things that the library and others are offering. So we just wanted to make sure parents had access to different information. So please, again, to Tiffany's point, if you haven't gone on there, please do so and see what we have for your children and families that are on there. And it's full of activities, and they get changed. It's not going to be one time only. We will be changing the activities and adding to it as we go forward. So back to the page here or the slide. One of the things, again, that you have to determine, and I'm hoping that the page that Tiffany brought up and I was explaining can also help as well. And that is to make sure that you remain connected. What we want is all the families you were serving pre-COVID-19 to come back. We want to make sure that you're staying in contact with your parents so that they will return to services in your program. But also when we find that they're not, we'll be working with you, as is our obligation and our responsibility to find out where parents are if they're not in your centers. And so this is going to be fluid as we go through this, constantly trying to capture how many children are in center-based care, how many children are in remote learning, how many families you're still in contact with through home visiting. We're going to continue through this process. We recognize that we are not on the other side of COVID-19 here in Chicago nor nationally. And so we want to make sure that we're doing everything we can in a healthy and safe way. And to the point about home visiting, we are not asking, and I just want to be very, very clear, we are not asking your home visitors to start going and knocking on doors to do home visits. What we are asking them to do is to continue to do home visits remotely with their families through this process and remaining in contact with them, sharing resources with them, and doing what they would normally do, but doing it through this remote access tool. So all of those things are required, and we need to continue to do those as we go forward. Next slide. So delegates who have partners, I just want to remind you that you'd have to give us the same exact information. In the report that we have to do by address and by site name how many children are being served. And so under Ada S., under Carol Robinson Center, under Henry Booth House, I'm just trying to think of a few of you who have delegates. Okay, and I know the number, but I can't say the name this morning, but many of you who have partner sites under you, as you're sending in your plans, we need their information too. We need to know what date they're opening. We need to know the group that they're going to have. We need to know the staff. We need to have just consistent information for your directly operated sites and your partner sites. And I know we were getting some from delegates, but we didn't get everything from partners. So I just want to make sure that when you're doing your reports and you're sending information in, that please include that information for us as well. Our side of this, we're going to be responsible for contacting sites, and we will be doing it remote. We have just started bringing back our staff here to 1615 Chicago Avenue this week, rotating them in. Again, just like what you're doing, we're trying to do the healthiest and safest return to work that we can here at our offices as well. So staff are coming in, they're working here in the office and also doing telework. So we're doing both of those between all of us here so that we can keep our numbers down, because what we know is the fewer numbers of individuals in spaces can mean that we can have a safe environment, and that's what we're doing as well. But our staff will continue to work with you. They will be asking questions about the number of children served. They will be wanting to know if you're having any issues or concerns. We want to know, we're partnering with you on this, and we're here to help. And so as we're reaching out, please let us know if there's anything going on that we need to know about, anything that you need to share, so that we can stay on top of it and assist you in any way that we possibly can. And if we are not able to do whatever it might be that you need, then it's our job and responsibility to seek resources and to try to assist. The other reminder, and I'm hoping that we won't have to do this, although I did hear yesterday of one teacher in one site that did test positive for COVID-19. So I want to remind you that for children, staff, parents, if they've entered your site and they test positive for COVID-19, that you must report to CDPH. You have to let them know that you've had a positive test, and you need to let them know what site. You also need to let us know so that we can keep an accounting of it, so that we're aware. One of the things that we also recognize is if we have positive, we have things that we need to do, and that is we need to clean, we need to sanitize, we need to disinfect. And in our last meeting, what I talked about is if you are doing this well, what you're looking at is being able to identify the number of children in groups. You know exactly which 10 are in that group. You know exactly which adults have been in that space. What you're able to do is contain and mitigate. But if you're not doing it at that level, that's where you find that you may have some incidents that mean that the entire facility would need to close. But if you are containing and mitigating, you may only have to close a classroom. And that's the kind of look that we're trying to look at as we're going through this. And so again, the reminder is you have any staff or children or anyone, you have to report that you have a positive case of COVID-19.
And in addition to that, you also want to make sure that you're approaching this in a very sensitive way on how you tell staff at your center, in addition to the families who go to your program. We have to make sure that we're maintaining confidentiality. You know, we're not pointing fingers at who has it, right? We have a responsibility to make sure that personal identifiable information is contained. But we do have to make sure that we alert staff and also our families.
And please make sure, to what Tiffany has just mentioned to you, that you are maintaining confidentiality. When I'm asking, my question is, I understand there's a staff member. I understand there's a teacher. I want to make sure that people are not sending to me via email personal identifying information. Let me say that one more time. The question is if there's a teacher, if there's a staff, if there's a family member. What I'm not asking for is for you to send via email personal identifying information on individuals that have been, who tested positive. We have a responsibility to maintain confidentiality. You can say what classroom, you can say a teacher, you can say different things, but you have to be very, very careful in how you share, because this is a person's health information. And we are bound by law through HIPAA and others to not share information. And only to those that it is required will be able to get the detailed information behind that. Next slide. So again, I just left these slides in and we went over these before, and I just wanted to remind people because we have had some questions about it. For the first 4 weeks of operation, you must operate with reduced group sizes. Our funders recognize it. Our funders are wanting us to stay as safe and healthy as possible, and understand that only a certain number of children will be in the building. And to my point earlier, you will be reporting the number of children served center-based, and you will tell us the number of children that's still engaging in remote learning with you. If you've operated, or one of your sites have operated as an emergency child care center with an emergency license, then they have already met the obligation if they've done that successfully for those 4 weeks. And at that point, they can increase their number of 10 up to 15. But your going up to 15 can only happen after the first 4 weeks of operation. City guidance, again, is the same thing. And we're saying it consistently between city and state. Next slide. And again, stable groups, you have to maintain your stable groups. And again, if something happens, you can mitigate by saying this group of children were only with these adults, and you can actually identify exactly where people have been in your facility. You can then mitigate the number of spaces that, if there is an impact, where you might have to close. So we just want to make sure that you're following this guidance. And you cannot allow children in your facility just to go from one space to another. They need to move in groups. They need to move to a playground, for example, in the same group. They need to move back to the classroom in the same group. They need to come into the same group. They need to leave in the same group. We do not want them moving. And I know in early education, we have had times where we have moved and said, you know, one teacher opens the room and she leaves, and then someone else comes at a different time. To stabilize your groups, they need to open together and close together. And I know some of you have changed your hours of operation accordingly, and we will want you, and I know in some of the reports that you've already done on your reopening plan have stated your hours of operation. Separate your children and put them into distinct groups and distinct rooms where you can follow this, so that you can say exactly where children are, and that is your responsibility through this process in order to state back to DCFS and to DFSS that you've operated safely for those first 4 weeks. And so your enhanced procedures, again, we can't say this enough. Clean, clean, sanitize, sanitize, disinfect, disinfect, and I know you guys do all of this and you are great at it, but what this also means is you are doing this 10 times more than you were before, and your plan has to be that you have the ability, capacity, staff, and materials to be able to do it. So again, it's looking at things and doing things every hour. When a teacher is touching something, that she goes and she washes her hands, that children are constantly washing their hands, that you're constantly doing this. The one thing that it doesn't say here, and I was in a conversation with someone yesterday, and I'm going to say this, and I think we all know in Head Start, if it isn't documented, it didn't happen. So your procedures need to be documented, and then you need to log that these things are happening so that you can say to others, if something happens, that you followed your procedures, that you ensure that these things were being cleaned, that these surfaces were being cleaned and sanitized, that children were not playing with toys that could not be cleaned. You're going to have to be able to document that you did this. And so carefully ensure that you have logs, for your cleaning logs. And I know you have different logs that you're already using. If you need to modify those, please do so, so that you can make sure that you can keep an accounting of the number of times throughout the day that these things are happening. Your maintenance staff should be logging what they're doing in and around your facilities. Your teachers should be doing the same thing in classrooms. And we can't say it enough. Document, document, document. If it isn't written, it didn't happen. Next slide. I'm just going to remind you, and I tried to get the online training dates, and I am checking my email very quickly as I'm going to talk you through the next webinars that are coming up are June 18th and also June 25th. We are working with our regional office to try to get, they're going to be doing training for us, and I will send this out, but we do have 2 dates that are scheduled, June 23rd from 9 to 11, trauma-informed care, and then we're also going to be doing them in July, but we will be sending out dates. So June 25th would be the date that we're going to send you. Trauma-informed care for delegates, again, June 25th, trauma-informed for delegates, and that's from 1 to 3. I will send that out so that you have that. And we do have a couple of other dates that we're trying to work on in July as well. But we just wanted to make sure, as we're opening and thinking about what we're doing, our staff, our children, our families, we've all been impacted by COVID-19. And then most recently, we've been impacted by everything that's happened due to George Floyd's passing and everything that's happened in our communities across Chicago and nationally. And what we have asked for is to do some trauma-informed care, some training. So I will send those dates out to make sure that you have those so that you can share those accordingly. We are doing weekly webinars, again, just to update, to see how things are going and what else you need from us. And so with that, I'm actually going to stop talking and we're going to start looking at some of the questions that you have.
All right, good deal. We're going to go ahead and bring up the questions. There was a question about where can we access the platform, and I believe that's the CEL pre-e-learning.
Right. That's on chicagoearlylearning.org, and if you click the resource tab, it's the easiest way to get to it. When you click on the resource tab, it opens up for you, and you can then surf through the pre-e-learning site.
Yeah, and what we'll do is just to even make it easier for you. Yep, we'll go ahead and send it out through the next CSD update.
Absolutely.
We're actually sending one out tomorrow, so we'll make sure that that the platform is included.
So if the school district doesn't open in the fall, well, agencies need to open. Prayers, it doesn't come to that for our children, and I absolutely hold that on high that it does not happen. But we don't know, Cindy, we don't know what's going to happen as we go forward. I will say to you that families need to still work. They need their child care. And I know that traditionally agencies have closed when CPS has closed. But what I'm going to say this time is I want us to all think about what does that do to families who need to work every day and they rely on you. And so we'll be looking at how safe and healthy and safe, and I want to keep that word healthy out there, how healthy and safe we've been able to operate within our programs to determine if we're ready to move further into the fall and continue to operate. I can guarantee you our funders will want us to continue to operate our programs and not to shut down. But I will say this, nationally there is, in 22 states, there are increases in COVID-19. Thus far, we've not seen it in Illinois. I will tell you that our governor, our CDPH, IDPH, all of them are going to be keeping their eyes and ears, and our mayor's office as well. And if it looks like we're going backwards in Chicago and in the state, a decision could be made for us to reverse orders and go back to a stay-at-home order. We're all hoping that that doesn't happen, that we're able to safely operate. But please understand that if it gets there, it won't be just us saying, you know, CPS is not going to open. It may mean that Chicago is at a point where we're saying that we're back beyond phase 3 and we're back at stay at home, again, for the safety in numbers and to keep us all safe, and then to reduce, again, COVID-19 in Illinois.
Yeah, and I want to remind everybody, too, that the governor did go ahead and open up schools starting in the summer. So we do know that, you know, this summer and headed into fall, that as of right now,
that's the plan.
Yep, that's the plan right now, unless something changes.
Yep, and so we'll see. They're doing the same thing, trying to figure out how to safely operate. Them opening up some in the summer allows them to do exactly what you're doing, to see how to do this safely so that they can figure out how then to have more children in the building. So we'll look forward and we'll keep it updated, and we'll keep you updated as we hear more.
Absolutely. And so the next question is about our PI and PFA award letters, wanting to know when those will go out. So I've been in contact with our contracts division. As you guys can imagine, there's a lot of stimulus money coming through our department and things like that. So they have been overwhelmed, but I can assure you that you will get your award letters at the end of the month. And so that's the best I can tell you at this point. You're going to get them by the end of the month. We can't set up these awards in our financial system anyway until July 1, but you'll have a condensed time frame in order to go ahead and kind of get this going and kind of work with us, so that way we can set everything up in our financial management system for you. So by the end of the month, you should have your award letter. If you haven't received it by the end of the month, make sure that you're reaching out to Tiffany Junkin.
Thanks, Tiffany. How are agencies determining the 10 who are invited to return? And again, agencies are going through their list of families and trying to see what parents are ready to return. They're looking, of course, at their system of bringing families back, looking at families that are homeless, they're looking at children who have IEPs and others. And some of those families may or may not feel comfortable returning at the outset of this, but all agencies will continue to work with their families, whether they're center-based or if they're remaining home. But from what I've talked about and what I've heard from agencies is they're going through their list and they're thinking about who the first 10 will be, and they're working with families to get them to return into their group.
There's a question about temporarily merging CCP toddlers with PI toddlers into one classroom. We want to make sure So in some cases, I mean, that may already be happening where you have kind of that mixture going on in classrooms. If you haven't done that, as long as you're respecting what the ratio is that, you know, Rachel already talked about, you know, that's definitely okay to be able to do. But remember what Rachel mentioned, consistency is key, right? Stable groups. And so if that's what you're going with to reopen, that's what you're going to have to go ahead and stick with, because we really need to make sure that we can trace things back, right? And so the group size needs to be stable. So if that's what you're introducing in your plan, just make sure that it's something that you can stick with.
And so who you report at DFSS that an employee or child was identified to have COVID-19, you will send that directly to Rachel Burgess Burnett, the Deputy Commissioner, and you will CC Tiffany Junkins so that we have it. And that's where I want you to send that information specifically to, so that we have consistency of messaging, because we have to also make sure that we're letting individuals know the information that we receive. And I'm going to say, remember, no personal identifying information in that email, please.
Absolutely. So there's a question about following guidance. Which one do we follow? If state and city guidance differ when it comes to disinfecting on an hourly or every other hour basis, which one should we follow? And what I really want to go ahead and tell you and kind of really challenge you to think about is safety within your program. Which one of them would you want to follow for your families? And trying to keep the safest environment for your children, families, and staff, you know, I would say follow the most stringent.
And as we do for all things here at DFSS, as you know, we say we follow the strictest guidance because we know the strictest one usually nets us the best. And so my recommendation is hourly, so that you know that, and this is my issue, if we go 2 hours, you end up going 3. So I carefully moderate back to my recommendation is hourly. That's the policy that you should put in place. It is the strictest one, yes, but what that means is you can then say within a 7.5 hour day or however many hours you're open, they can then talk about how many times that you've been able to spend some time ensuring that that space has been disinfected and cleaned. And children move a lot, people move around because of everything going on. We have to make sure that we're doing as much as we can to continue to keep wiping down surfaces. You got people coming in and out of doors. You want to make sure that the knobs on the door and all of those things are constantly wiped off, because anything touched, there may be something there that you want to make sure no one else comes in contact with. So clean, clean, disinfect, disinfect.
Absolutely. So there's a question about, is there a specific contact person at CDPH that we could contact should we have a positive case?
We will give you the number, the email that we're talking about going out. We'll give you the number that they're asking everyone in the email that they're asking you to get in touch with. And then their staff will take that information and follow accordingly. But we'll send that out with the other information that we're sending to make sure that you have it. How soon are you going to get approval from your reopening plan? Your licensing rep is the approver of your opening plan. I am a reviewer, and I'm trying to make sure that it meets our guidance and our standards. I am trying to make sure that within your reopening plan that you speak to the number of children, the number of groups, and if you don't, we're asking that question. I'm looking to make sure, for example, in there as your DCFS licensing rep is that you're talking about not doing toothbrushing. We're looking to make sure that you're talking about not doing family style meals, that you're going to do plated meals. And I'm looking to make sure that you have in your plan how you're having families come into your facility, how you're looking at how you're transitioning children, and that your staff are being trained. I'm looking for those kinds of things. But the approver of that plan is your DCFS licensing rep.
Absolutely.
I do have a log that we can send you. If you don't have one, we can send you a log that you can manipulate for yourself. Yes.
Thank you, Rachel.
You're welcome. Can remote learning and virtual home visiting engagement count as in-kind? I would have to say no to that because it's an obligation and a responsibility based on your funded program. And so doing it is not above and beyond. It is a requirement to stay in touch with your family. So it is not in-kind. It is not outside of what you're already funded for.
our reopening plan, it was submitted. Should we wait for your approval or proceed to open the days we have scheduled in our reopening plan?
Reach out to your licensing rep and make sure that your licensing rep has no issues with your opening plan. As long as your licensing rep approves it, you are approved to reopen, because that reopening plan, just so you understand, that reopening plan is attaching itself to your current license. And so you need to make sure that you have an approval to open from your licensing rep, and that you've answered any questions that your representative may have regarding anything that's included or something that you may have missed, in order for them to say yes, that you can reopen. And they will not approve you to move to increase unless you're able to show that you've been able to do this successfully for those 4 weeks.
The next question is about PPE that's being collected for students. Is there a date and place where we can pick those supplies up?
Well, right now, PPE is on hold. We don't have any information yet. As soon as we know more on PPE, Tiffany and I will be back in contact with you. Sad to say, we wanted to have an update for you today. I did not get it before starting the webinar. So if we are able to obtain PPE, it is very, very difficult. I am pursuing one other piece of information, and as soon as I can confirm that, then we will be back in touch with you regarding PPE.
Absolutely.
Any update on slot reallocations?
So we're working our way through slot reallocations, and I know that we're working our way a little slow. So Linda and anybody else who has any questions about slot reallocation or when am I going to get to yours, please go ahead and email me. Email Victor, and then if you know your supervisor on our programs ops team, if you can go ahead and include them in on that information as well. When it comes to moving slots around or slot reassignment, some of these have been facility issues, us needing to get out to the facility. Some of them may not be facility related, but just know that we're in the process also of trying to plan those facility assessments when we can get our folks in the door when it comes to kind of moving around slots in that manner. But definitely follow up with me offline, and we'll make sure that we're addressing your particular request.
Yeah, and I mentioned it before, and the question is about the turnaround time for DCFS to return your reopen plans or say that you're approved. My recommendation to all of you is you reach out to your licensing rep if you've not heard. If you've submitted and have not heard, remember that your licensing rep has large caseloads. You want to know that everything's good to go for you. Please reach out to your licensing rep. When I've read a plan, if I saw something that was needed, I've gone back to the supervisor of your team, and what I've done is asked them to reach back out to you for additional information. So if you've gotten something back from a supervisor saying, can you also give me, it's because I've reviewed it, saw something missing, and I'm trying to make sure that everything comes through them. And so I've gone back, and I know emails have gone back out, and I've gotten some of the information that I've requested by doing that. And so I'm reviewing them as they come in. I've got, I don't know how many emails that came in this morning, so I've got quite a few to try to read into, whatever hour I have during the day and into the night, because I'm trying to keep up with them as they're coming in, because I don't want me to be a blocker or for anyone not to be able to reopen. But your licensing rep is the one approving your plan. I'm asking you for additional information that DFSS needs that is a requirement for our funder.
Absolutely.
While standalone home visiting programs are still providing virtual home visits, no contact, do we still need to report any positive cases? Anything that you hear that would help us keep an accounting of what's going on in community, Constance, I'd ask you to still send me and Tiffany an email so that at least we're aware of what's happening with your families. It'll keep us up to date. It'll keep our numbers straight on what we know about what's happening with our families around Chicago. And I did say, did you say we are not to do toothbrushing? So Rachel did say, for the time being, that the recommendation was that you not toothbrush. Again, we're trying to make sure that you're able to do all of what you need to do within your program. We know trying to add toothbrushing to every hour cleaning, sanitizing, and disinfecting. And also, we understand also in toothbrushing that the risk of germs, splashing, and all the things that happen, we're giving you permission. If you did not know, we're giving you permission, you heard it from Sareto, to not toothbrush at this particular time. Yes, toothbrushing is now temporarily temporarily off until further notice. Again, we want you to be in healthy environments, and we don't want anything that's going to promote anything like that. So we're asking you not to do that.
The question is about, is there guidance about allowing admin staff or any other staff from our other programs in the facility?
And Eva, I'm not sure what you mean by other programs, and I'm going to say this. You have an organization, and you have to have a containment measure of who's coming in and out of your building. I've already said to my monitors, for example, until further notice, we're not coming into your building unless there's an emergency. And then, then we will let you know that we needed to be there because you've let us know that we need to be there. Minimize the number of people that are going in and out of your facilities so that you can then minimize what you have to do if you have to do contact tracing. If something happens and in a building, if you've had some of your admin staff who've gone into the facility, you need to know the exact date and the time that they were in the other facility. You need to know exactly where they went in the building within the facility so that if you're having to do contact tracing, you can walk it back to the who, the when, the where, and the who they were in contact with. And so I can't tell you not to have them in the building, but what I can tell you is you need to have a plan where you can document who came in. You know exactly when they were in the building. You know exactly when they left the building. You know exactly what spaces they were in the building, so that in case of having to contact them for any reason, you can document that they were there, or in some cases, you would be able to say, no, my staff from this building were not in that building in that given day or time frame. You've got to be very, very diligent in your documentation about who's going in. Even if there's a vendor that comes in, you should know what vendor came in for what reason. You need to have their contact information, email, and phone number, because if they come into your building and then there's something, you need to be able to contact them to let them know you were on our premises in this space at this given time, and this is an update that we need to share with you.
That's a very good point too, Sabrina. When I think about, just kind of how we're messaging too, right? Whether it's our admin staff or any other staff or vendor that's coming into our building, making sure they know what your policy is, that it's very clear that the expectation is mask. If it's a vendor that maybe they have on mask, gloves, and booties, as they kind of walk into your building, but you really do want to set those expectations upon entry.
And please, 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 every visual that you can have for every individual so that they can see exactly what your policies, procedures, and guidance is. Make sure that you put that up on the doors, on the walls, in classrooms, so that everybody is constantly reminded about hand washing, that they're constantly reminded about masks, that your staff are constantly reminded about your sanitation policies and procedures. In your training, go over it, go over it, go over it. We know for any training, people get about 10% of what you're training on. What they get 70% of is when they're constantly reminded and have an opportunity to practice. So please put all of these policies and procedures into practice with everyone, and that includes your parents. So I do have one other document that I want to pull up really quickly. Those were the questions for now, and we'll go back in a moment to see if any others come up. But I just want to pull up another document, the CDC document. Because one of the things that it shows you, for example, is should you consider opening? Will reopening be consistent with applicable state and local orders? And you've got the guidance, you've been working on your plans, and you're adhering to those. If you're not able to do what it is being asked in those, then you shouldn't open yet. Are recommended health and safety measures and actions in place? Do you have all of the safeguards? Can you make sure that everybody understands those? That's why I'm saying the visual piece. The visual. You got to promote healthy hygiene practices. Wash your hands. Wearing masks. You've got to make sure that employees are doing exactly what it is that you've said needs to happen. It's for their health, and it's for the health of everyone else. Cleaning, sanitizing, disinfecting, and making sure that you can ventilate classrooms and open windows and those kinds of things. Social distancing. We've talked about the 6 feet. Not only are we talking about 6 feet when you're standing next to someone, it's 6 feet napping. It's 6 feet napping. That is not wasn't your current standard, but it is now. You need to have your cots 6 feet apart. You need to have children sleeping not face to face. They need to be sleeping, you know, a child's foot is near another person's head so that they're not breathing at each other when they're napping. So you've got to have teachers thinking about exactly how the children are going down for nap. And we know children move sometimes during nap, and teachers in the room need to go back and do everything they can to keep children away from each other, from breathing in each other's space. And so if you can't do any of those and you can't meet any of the safety standards first, then again, think about, am I ready? If you're not ready, then go back, look at your policies, look at your procedures, do what else you need to do so that you can safely reopen. And then when you're in your ongoing piece, and I said monitoring, what I'm saying is you need to have laws. You need to be able to go in and make sure that the things you talked about are actually happening. That if you're, you know, the symptoms check, you know at the beginning, families who are coming in, you know if the child is ill coming in the door, should not be in the door. Your staff understand if I'm sick, I'm calling in, not coming in. Again, if I'm sick and I have any of these symptoms that are COVID-like, that I am calling in to let you know, I'm not coming into the center to tell you for you to send me home. But that's work that you have to do with your staff because you encourage anyone and everyone, including yourselves, to stay home and take care of yourself. And then you're going to monitor. You're open, you're monitoring. You're open, you're monitoring. Regularly communicating and monitoring developments like I said to local authorities. Again, letting people know if there's a case or an exposure. You're monitoring your child and employee absences. If you have children that are absent from program, you need to be following up with the family to understand why that child isn't there. If you have a staff member who isn't at work, follow up and find out why your staff member isn't there if they have not called in. You need to know what's going on because that, again, is one of your risk management pieces that you need to have in place. And then again, if you can't meet these standards, then you have to think about, should I remain open? Again, open and monitor, open and monitor. You've got to stay on top of all of what it is that you have to stay on top of. And I know it's a lot. I don't envy any of you with everything that you're having to do as far as the number of times that you're saying to a teacher, make sure that they're cleaning. I don't envy, you know, you having to explain to your parents about only 10 children in group. I understand all of what you're doing is very difficult on your side. I encourage you, and I encourage you to constantly speak about all of the health and safety precautions and procedures that you're putting in place because your number one piece is about keeping everybody healthy and safe. Everyone needs to hear that from you, and they need to clearly understand that you are doing everything you can to keep your doors open so that you can continue to provide care and that you are going to be monitoring, and your staff need to understand this is not a one-time and done. This is how you're going to be doing business going forward. When we think about what we're doing, no one can predict or project when we will be on the other side of this, and we will go back to any version of what anyone wants to call normal. These are practices that we're asking you to put in place that you will be living with for a very long time. And so I thank you for everything that you're doing. And I'm going to look to see if there are any additional questions.
And before we get ready to exit, I just wanted to make an administrative announcement regarding COLA. We've had a lot of applications that have come through, and I just wanted to say, one, thank you. We've had a few applications that have come in where some of our sites, some of our centers and agencies are asking to decline COLA. And our deputy commissioner, she sent out a message yesterday to everybody to have people understand that the reasons and excuses that we've had and we've been able to use in the past about declining COLA because we couldn't give it to everybody in the organization, so I can't just give it to my Head Start funded agencies, it's not going to fly this year. It's not going to fly. We're not going to be able to use that excuse with our regional office. And so we're trying to let you know now that if you've already sent us an application and you don't want to accept COLA, we need to know what the reason is, because the reasons that we've been getting, we're not going to be able to accept those. We're not where we need to be in terms of salary parity, closing the gap, and the salaries that we wind up putting in the RFP, we're asking you and we need your help in order to get there, right? But we know that those were minimums. And so we really want to make sure that, you're not declining COLA, at least not for the reasons that we've received thus far. So we're going to ask you to rethink that. In addition to that, we've also received on some of the COLA applications, there's been new items being put into COLA. COLA, you can only do increased costs on things. So if costs have increased, and you could go ahead and claim the difference. What you can't do is go ahead and say that now we're under COVID-19, I have these PPE needs that I didn't originally have in my grant that I want to go ahead and write into it. You can't do that. I do want to let you know, because we are understanding that this is a different time that we're in, and we want to be able to speak to what those needs are. We just can't do it in the COLA application and the quality improvement dollars, right? Trauma-informed things, yes. But if we're trying to write in for PPE, no. And so we are getting some funding. We know that we're going to get some funding from HHS around, CARES Act, and we'll be able to get money out to you. We're working on a plan internally so that we can let you know how much that will be. So there's going to be a plan for that, and I don't want you to think that just because we're asking you to remove those things that we're not going to be specific about how we can address those things. But we have to leave it out of the application, though, for COLA and also quality improvement dollars. Thank you.
Thanks, Tiffany. And so, again, what we wanted to do was spend some time with you today, going over reopening your programs, the documentation and information that we need for our funders. Want to remind people, because I know the question has come up, and I just wanted to be very, very clear, that you are serving children that you had enrolled with pre-COVID-19. Now, those are the enrollment numbers that we are working from. And so when you're sending us your groups, if you're only opening 2 groups and you were funded for 3 groups, the assumption then would be one of those groups, plus perhaps some additional children, are being served remotely. And we need you to identify those numbers for us. What I have to eventually do once we get all of this together is say how many children are served center and what's the percentage of children and families that's still in remote learning. And then we will, as we go up and as we can move forward, we will be adding numbers and saying, in June we're here, July we're here, August we're here. We know that there's going to be some timing and some movement as we go through. But we're here to support you. We understand that some of you are ready to go starting June 15th. We're hoping that everything starts off as well as it possibly can for you, that you have everything that you need, but we're here if you have additional questions. We have some that are saying the following week. All we need, we just need to know what date for each site. And again, I want to emphasize to those of you who have delegates who have partners, family child care homes, or other centers, we need to know their reopening plan as well, so that we can keep an accounting of how many children are being served in a given week and how many children are being served in a given month. And so that's the assistance that we're going to be constantly asking you for. Stay in touch with us, and we'll stay in touch with you. And we're looking for safety in numbers, meaning our programs to open safely, remain open, increase the numbers after 4 weeks, that we continue to move on the other side of COVID-19, and that we all have a happy summer. So we all have to look forward to something positive. So I'm trying to look forward to some positive things out there. So again, we're here if you need us. I'm not going to keep you on any longer than we need to. I'm going to look one more time to see if there's any additional questions. And if there's not, then we're going to go ahead and let you go for today. And so from the list, there are no additional questions. So right now, what I do want to say, there's one more, I'm sorry. Brenda, what guidance would you provide on how to staff the remote learning when children, all our staff, are in the classroom? What we're looking for, if you've got family support staff or whomever else, what we're looking for is, can a teacher who's even in center, if you've got 10 children in a group and you've got 2 adults, can one of those teachers get on the computer and do a Zoom with a group of parents? I'm just asking you to be creative. I can't give you a absolute plan on how to do it. I'm asking you to think about all of the staff that you have at your organization who might be able to assist you through this process and how you might be able to team some of the work to get it done. The one thing we don't want to have happen, Brenda, is that we lose contact with those other families, because as you get ready to increase your numbers in 4 weeks, you want those families to be ready to come back. And the only way we're going to do that is if we stay in contact with these families. And so, again, I don't have a perfect answer for you, Brenda. I would just ask you to think creatively on how you might be able to do it. The staff that's in the classroom based on a plan, and you can decide how you're doing it. And again, they're not, a Zoom meeting isn't all day. There may be a time in the day when a staff member who is a classroom staff can be a part of the remote learning. I'm not trying to divide staff for you. What I'm trying to do is stay in contact with all of the families. They would be counted in the classroom because I'm looking at the number of classroom staff. I'm not counting the number of staff that's virtually communicating with parents, because I'm asking you to use whoever you got for that. I just want to make sure that we are staying in communication with our parents through this so that we don't lose sight of that and they don't lose connection to you. And so, again, I just want us to think about the ways that we might be able to make this work.
All right, looks like we made it through all the questions. We want to thank you for your attention and your time with us today. I think this was a lot of good information.
So thanks, everyone. Thanks for sharing a part of your busy day. I know you're out there trying to get yourselves, if you have not opened, ready to open. So I thank you for all that you do every day and for taking time out this morning to be with us. And so with that said, have a safe rest of your day and a safe rest of your weekend. And we'll talk to you next week. Thanks, everyone.